back again to our Being Woman series in the for the health of women. We already discussed the anatomy and physiology of the women's reproductive system. We have come into discussing the abnormalities of menstruation. We did part 1 on painful menses, dysmenorrhea. We did part 2 with absent menses, amenorrhea. And now we come to part 3, which would be menstrual problems, part 3, abnormal uterine bleeding. Okay, so now you're bleeding more than you want. In part 2, it was like you're not having menses. Now we're having menses, but it's profuse. So we call abnormal, this topic we have for this discussion is abnormal uterine bleeding, or in short, AUB. Now, AUB, or abnormal uterine bleeding, is the condition wherein when a woman has menstrual period irregularity or abnormal bleeding pattern. Okay? It's abnormal bleeding pattern, usually a little bit more profuse. Okay? So, it's the condition wherein a woman has menstrual period irregularity or abnormal bleeding patterns. According to the International Federation of Gynecology and Obstetrics in 2010, they redefined AUB as the bleeding that is abnormal in duration, abnormal in volume, abnormal in frequency, or regularity, and has been present for the majority of the previous 6 months. So it has to be at least 6 months to be diagnosed as AUB. You have to abnormal duration, because the normal duration is about 3 to 5 days. Abnormal in volume, because it's about 30 cc, sometimes to 80 cc. And if it's more than that, then you have a problem. If it is more frequent than 21-day cycle, because the 21-day cycle is the lower of the range of 28 plus or minus 7 days, or regularity, lack of regularity, and it's been there for more than 6 months, then you fall under the diagnosis of abnormal uterine bleeding. They account for about 33. So 1 in 3 of the patients that the gynecologist gets is abnormal uterine bleeding. 1 in 3. So that's a very significant amount of patients that you get, that the gynecologist gets, or that women suffer from. This problem can significantly affect the woman's health and well-being, of course, because you don't like to be wearing your menstrual pad every time, all the day, forever, because it's even cumbersome for the amount of days that you use it when you're having menses. And then bleeding, you lose hemoglobin, you lose iron, and you become what they call this anemic very quickly. And when you're anemic, you lack oxygen to your body, so you have other problems. You can't concentrate very well, you can't sleep very well, your heartbeat goes faster than necessary, your body's working overtime to be able to get you to be up and about when you lack oxygen, because you lack hemoglobin, because you've been bleeding so much. So it is a problem really that affects a woman's health and well-being. So we got to talk about this, because this is problematic. It is really problematic. And again, we will have to study why this is so. Okay, so any bleeding is considered problematic in premenstrual. So before she even goes into menses, she's already bleeding. You remember, 12.4 is when you start having menses, and then you go all the way to the time when you're menopause, the reproductive age. But if this girl did not even have menses and she's profusely bleeding, premenstrual, and already menopause, and she's bleeding, then that is a problem. Any bleeding is considered problematic in premenstrual and menopausal women. You remember again, we can never forget, we always have to put this forward. Normal menstruation occurs every 28 days, plus or minus 7. So within 21 to 35 days would be considered more or less normal. If it's more than 20, it occurs like every 20 days you have a menstrual cycle, that is problematic. If after 35 days you have your menses, it's problematic also because the average is 28 plus or minus 7. And it should not last more than 7 days. The regular is 3 to 5 days. But if you're bleeding, even if it's only less, not really a lot, you don't have to change your pads very frequently through the day, but it's beyond 7 days. You're bleeding more than you should be bleeding. Little trickle here and there, trickle, trickle, trickle. But when you trickle a lot, trickle long and prolonged, you would lose a lot of hemoglobin, and that's abnormal already. That's according to Matheson et al. Abnormal uterine bleeding in this Journal of Women's Health article. 10 to 30% of women will experience abnormal uterine bleeding in their lifetime. And now it's becoming more and more because of lifestyle. Women don't exercise that much. Women cannot control what they're eating or are not aware of the food they eat and the types of food that can make them problematic. Women don't sleep. We don't sleep early anymore. We're so stressed out. So we're having more problems than we really are supposed to be having because of the lifestyle we live in. So it is important for us to take into consideration these things because you don't want to be problematic as you grow older. And problems that accumulate through the years will make your quality of life and quantity of life not good for you. And how can you be the best partner for your husband? How can you be the best person working in the Lord's force if you don't take care of yourself? You don't take into consideration that what you do to your body will take effect on your life and the life you live and the service you can give to mankind. So let's go forward in our study of abnormal uterine bleeding. Okay, according to Whiteman et al., inpatient hospitalization for gynecological disorders in the United States, American Journal of Obstetrics and Gynecology. This is taken from that journal. Around 1/3 of all gynecological visits and 3/4 of all visits for perimenopausal and menopausal women are due to abnormal uterine bleeding. So perimenopause, they have abnormal uterine bleeding more the amount, more the frequency around perimenopausal and menopausal women. It's really abnormal. You have to be watchful because they can be problematic. Okay, according to McCann's and Hueter in Pathophysiology, the book, Abnormal Uterine Bleeding of All Causes is the top cause for removal of the uterus. And the removal of the uterus is the term for that is hysterectomy. To remove the uterus, abnormal uterine bleeding of all causes is the top cause. So when they have abnormal uterine bleeding for whatever the cause, a lot of times they just remove the uterus because you cannot deal with it. And you cannot deal with just take it out. I cannot deal with this thing. On most of the abnormal uterine bleeding, pooling, etc., amenorrhea, or rather, anemia, bleeding. So they just decide to take out the uterus. A third, the top cause of hysterectomy in the United States is from abnormal uterine bleeding. According to Matheson, abnormal uterine bleeding, health status, and usual source of medical care. This is another journal. Majority of AUB is due to an ovulation. In other words, she's not ovulating. And if she's not ovulating, the HPO axis is problematic, and majority of AUB is an ovulation. And we remember, an ovulation causes no menses, amenorrhea, and you make yourself prone to have problems in the future when your bones will not be strong, your constitution will be weaker if you don't have regular menses when you should have had menses in your lifetime. Okay, so let's go to this sort of like a little bit complex table that I have here for us to consider. We have here in the blue box abnormal uterine bleeding, heavy menstrual bleeding, AUB or HMB, or intermenstrual bleeding, IMB. So abnormal uterine bleeding can be very heavy flow of menses, or bleeding in between cycles. So if you have your menses every 28 days and you bleed in between the 28 days, that's intermenstrual bleeding. That will still fall under abnormal uterine bleeding. And we have here the dark salmon and pink boxes. You have the letters PALM for structural causes. So you have, if P stands for polyp, okay? Polyp growing in the uterus, it's not normal. You don't have a normal endometrium. So there's something that's growing there, which we call, it's a polyp. It's a pedunculated growth, okay? You call that polyp. It can cause bleeding. You have adenomyosis, and we're going to talk about this later. But adenomyosis, in short, is the lining of the uterus inside the muscle of the uterus. The lining of the uterus is supposed to be lining the uterus, not anywhere else. But here in adenomyosis, abnormal uterine bleeding A, adenomyosis, you have the lining of the uterus incorporated or inside or migrated into the muscle per se of the uterus. So that one causes bleeding within the muscles of the uterus. Then you have leiomyoma. Leiomyoma, that's a scientific term, but irregular, we call it fibroids. And when we talk about masses in the uterus, we say fibroids, okay? Leiomyoma, we call it fibroids regularly. And especially if you have it in the submucous. We're going to discuss fibroids later, but you see, the fibroids can be, or leiomyomas can be located in certain areas of the uterus that when it is irritated, it bleeds out, and it can be either heavy menstrual bleeding or intermenstrual bleeding. Then you have malignancy and hyperplasia. Hyperplasia is overgrowth. So if you have the lining of your uterus overgrowth, you can bleed. If you have a malignancy, you can bleed. So when you're bleeding in premenopausal and most likely postmenopausal here, it can be hyperplasia or it can be a malignancy. So it's very important to get yourself checked, especially if you're peri or postmenopausal, because you see the problems, they are masses. Polyps are masses. Adenomyosis is growth somewhere else where it's not supposed to be. Leiomyoma, fibroid is a mass, it's a growth. Malignancy and hyperplasia, they're not normal growths. You don't want them. They can cause problems, okay, especially if it's malignancy. So we got to check these things out. When we have abnormal uterine bleeding, we got to have it checked. So that's the salmon box. We come to the pink box, and you have COEIN, non-structural causes, meaning it's not a mass, it's not a tumor. So you have, for the first one, coagulopathy, meaning she has a bleeding tendency. There are some women, like, somebody scared somebody, right, and said, you're eating too much garlic. You're eating too much, vegetarians, their blood is thin. But, the body knows what it's supposed to eat. The body knows how to control. But you see, sometimes when people have what you call the coagulatory problems, like they bleed, they just have a wound and they bleed, and it takes a long time for their blood to clot. You call that coagulopathy. So this abnormal uterine bleeding can come from coagulopathy problems. In other words, they're just having menses, but it cannot clot. So the coagulation does not happen, or the clotting doesn't happen, and she can bleed profusely and abnormally from that. Then you have ovulatory dysfunction. So there is problem with your ovulation. When there's problem with your ovulation, obviously estrogen and progesterone are problematic. And if they're problematic, you don't have a regular cycle, then you can have bleeding. Then it is not a mass, it's just the ovaries not working properly. Then you have endometrial. Endometrial problems is the third one. When the lining of the uterus is problematic, it's not a mass, it's just problematic, you can bleed from endometrial problems. Then you have what you call the iatrogenic or iatrogenic. They don't know where it came from. You're just bleeding. And then there's this thing when you do not really know what is causing the bleeding, not yet classified. They're bleeding, but it does not fall in specific classification. So you have COEN for non-structural causes, and then you have PALM, PALM, for structural causes. Think about these things. When you're going into abnormal uterine bleeding, these are the things that come into the mind of your gynecologist. Again, as I said, and I'll always say, it is important for you to seek consult when you have bleeding that is not normal, okay? Not regular, not normal in amount, and not more frequent than 25, less frequent than every 35 days. So have to check that one. Also associated with pain. These things put in your mind, young lady, especially if you are going to have an active life in the future. Be cognizant, my dear sister. You don't need to suffer, but you need to, education. We are counseled that we have to educate. That's why I'm doing this thing. So I want to share that it is important because I suffered these things. I cannot overemphasize, how hard it was for me to go through all this. I bled profusely and I had dysmenorrhea. Oh my, it was hard. So please, think about this and think about the natural remedies that we have talked about a little bit more. So let's go and cover some more a little bit. So the PALM-COEN system for classification of abnormal uterine bleeding is what we have just discussed in the graph. So we come forward to, I have here a picture of the abnormal uterine bleeding. Okay, so we have here polyps. So you can see these little things growing here. They are in the lining. It can even be here in the cervix. As long as there's a lining, you can bleed from this area. This is the P in polyps, in PALM, structural problems. Then you have adenomyosis. So you see the uterine lining is supposed to be lining the uterus here. It's supposed to be the seed bed of your uterus for the baby to implant. But this lining goes into the muscle of your uterus. So that's adenomyosis. Then you have leiomyoma or fibroids. So they are masses within the muscle of your uterus. These are fibroids or leiomyoma. If it is submucous, it is in the lining here in this area. There's no, or this one here. You can see here that it is affecting the lining of the uterus. They can bleed from this one. And sometimes it's even very small only. It's like a marble, just even smaller than a marble. But if it were in the lining, under the mucosal lining, under the endometrium, she can bleed from that one. That's easy to deal with though. You can just send in a little scope and take it out. And then the bleeding would stop. And then you have malignancy, okay? So you have malignancies or cancers like this, either in the uterus or in the lining. And we have here PID, inflammation. This is not here, okay? But this is infection. PID stands for pelvic inflammatory disease. So if she has had some infection that we talked about, no contact during menstrual period, no sexual contact during menstrual period because the cervix opens and the bacteria in the vagina can go in there. Or if a lady has had illicit sex and she got either gonorrhea or something that can cause inflammation, then it can cause infection in the lining of the uterus and she can bleed from there. So that's abnormal uterine bleeding in that aspect, the PALM structural causes. Then we come to the non-structural one, the COEN. You have coagulopathy. You remember the coagulopathy, right? Oh, you remember the ovulation also problems? And you remember this HPO axis thing? Okay, then the lining of your estrogen, and then some causes that are not defined. So again, I cannot overemphasize that natural remedies can help. especially in the non-structural ones. And also in the prevention, natural remedies can help prevent. And even so in Ministry of Healing, we have the 8 natural doctors, right? We have the 8 natural doctors, like breath of fresh air, light of the sun, unwavering self-control, exhilarating exercise, pure air, rest, ideal attitude, trust in God, and temperance. These are the natural doctors. When you do them, you prevent diseases from coming to you. So it's important for us to know these things, to put them to heart, because these are the things that can prevent diseases. And fortunately, by God's grace, we can even take care of the non-structural problems that are associated with our women's problems, our women's diseases. So let's go to the natural remedies. Again, it goes to say without saying. Natural remedies, the first one you would already know is weight loss. To rid oneself of extra ovarian estrogen production. I will always say this. You can make your body's estrogen from the fat that you have exaggerated amount of fat in your body. So if you have an exaggerated amount of fat in your body, you will have exaggerated amount of estrogen in your body. If you have a lot of estrogen, you remember the feedback mechanism. When there's that feedback mechanism, you will not ovulate and you will not have menses. So you don't want that. So weight loss, what are they? You watch your food intake. You watch your food intake, meaning be careful about the carbs you take in. Be careful about the protein you take in. Be careful about the fat you take in. Be careful of exercise. Watchful exercise, not pumping iron, not becoming what you call this, a climber in the steep side cliff in Yosemite or whatever. Not that kind of exercise. And have to sleep. You have enough sleep every day, good uninterrupted sleep, and stress management can help you control weight and do weight loss. Okay? Then we have this interesting thing. Avoid xenoestrogens. What are xenoestrogens? They are estrogens that are produced, that are found estrogen-like things. Okay? They're not specifically estrogen, but they work like estrogen. They are called xenoestrogens, and they are more potent. Even some of them like to 50 to 100 times more potent, and they latch onto the estrogen receptors in our breasts, in our uterus, and in the different parts of our body. And if the breasts are very full of a lot of estrogenic receptors. So if you have a lot of estrogens, they will stimulate your breasts to have masses. If you have a lot of estrogen in your body, they will stimulate the lining of your uterus or the muscles in your uterus to grow beyond the time they're not supposed to be growing, or more than they should be growing. So xenoestrogens are out there. It's like our life. We are exposed to xenoestrogens left and right in these days. So why is it my grandma did not have this, did not have that? My aunts didn't have it. My mom was okay. She had several children. My grandma, my lola, my abuela, my abuelo, they were 12 in the family, and then now we can hardly even have one child. Why? Because there's so many things in our environment and in what we do to our body. So an example of a xenoestrogen is the chemicals that have estrogenic properties. Okay? Chemicals that have estrogenic properties. Perfumes and lotions. Oh, you have to check, because in the perfumes and lotions, there are stuff there. Okay, I remember when I was doing my internship. I was doing my internship in one of the big maternity clinics in Metro Manila. And they, when a woman gives birth, they get the placenta and they put it in a freezer. Okay, HIV was not very rampant at the time yet. Bloodborne diseases, not so much. But anyway, they checked whether the mother was bloodborne disease positive or not. They would get the placenta, put in a freezer. Then what are you doing with these placentas? Okay? Oh, they get the estrogen placenta, they extract whatever they can get, hormones from that placenta. See, the placenta has a lot of stuff in it. So they get the placentas, they get the estrogen, like, and put in oil of ole. I might be, no, okay? That just example of that. They have this estrogenic stuff, and they put it in perfumes. They put it in lotions. And so, I'm saying something that some people might not like, but I'll have to say it anyway. Sometimes I have patients that come into my clinic. Ooh, smells so good. Oh, I love the smell of your perfume, madam. Usually these ones with so sweet smelling perfumes, they are estrogenic, okay? Estrogenic perfumes. They are somehow subconsciously affecting you. And these people with flowery perfumes, they affect you. Like you see, the flowers have smells, so it attracts bees, okay? So these flowery smells, these people in manufacturing, they know that these things have some subconscious, you're not conscious about it. You remember the what they call this, the advertisement of this guy who sprays Axe on himself, Axe the perfume, and girls are following him like mad, It's like that the flowers send out a scent, and so insects come to help pollinate. It's the same way we do. Are you kidding me? You smell good. So if you're a lady and you smell, and she passes, you follow them, okay? It's the same way. And that smell affects you, okay? That is an estrogenic thing that affects your HPO axis. It is a xenoestrogen, very strong. So you have methyl parabens. They are found in perfumes. They are found in lotions. Look at your thing. That's why they say paraben-free, because these are chemicals that can cause problems, okay? Watch for parabens. Then you also have phthalates. Phthalates are in the lining in your water bottle. Okay, so that's why we're not supposed to put water bottle inside our car, and then it's so hot, so it enhances the leaching of the phthalates from the water bottle into the water. So you're drinking water that has been leached into with parabens. You're increasing your water intake, but you did not take extra care. You have a plastic bottle that has phthalates in it, and you're drinking that kind of water. And then you also have linings of plastic, linings and plastic, can linings. You have what they call the BPA, or the bisphenol A. These are very, very strong xenoestrogens. So sister, watch out. These things are in our environment. Very innocent, just a perfume. Very innocent, just a lotion. But we swathe ourselves with the lotion that has this estrogenic stuff in it. We spray ourselves with this thing, and we get it. It gets into our HPO axis and messes our HPO axis, and we result in abnormal uterine bleeding because of the lining being so much estrogen affecting the lining of the uterus. We got to be watchful for that. So important points for our abnormal uterine bleeding. Things to remember. When you have abnormal uterine bleeding, Dr. Fernandez said that's easy to deal with that. I didn't say that, okay? It's not. You have to find a healthcare practitioner. Find a doctor who will distinguish that thing, because it can be benign, it can be pre-malignant, or malignant causes for your bleeding. If benign, well, check whether it is organic, whether there's a mass there that is just a benign mass, or if it is hormonal, then deal with it if it were benign. But if it were malignant, then it will even have to be dealt with even more. It is important that when you seek consult, a good medical history, a good physical examination, and laboratory tests should be done, because it's not a joke to have abnormal uterine bleeding. It is necessary to diagnose abnormal uterine bleeding cannot take for granted. You cannot take it for granted. Never self-treat your abnormal uterine bleeding. Never self-treat unless assured that the cause is dysfunctional uterine bleeding or abnormal uterine bleeding or hormonal in cause. So if it's hormonal in cause, easy peasy. You can deal with that with your weight management, exercise, food, and all those stuff we discussed. It is important that you never self-treat until you're very, very sure of your diagnosis. Now we come to what is one of my most favorite stories in the Bible. Okay? You know this one, right? The story of the woman with an issue of blood for 12 years. In Mark 5:25-29, and a certain woman which had an issue of blood 12 years. Oh my. She was bleeding for 12 years. And in that society, when you're bleeding, you're unclean. So she cannot be with people because she's bleeding forever. So she was like out like a leper. You can't come near me, you're dirty. For 12 years. She had suffered many things of many physicians. So she was going to the doctor on and off, on and off. But the Bible's the one that said this. She suffered. She allowed the doctors to treat her and had spent what she had. Oh, she became poor. It happens like that now, right? All our money we accumulate money through the years. And then we get sick from not being temperate. And then we spend our money to get better. So like this. She had suffered many things of many physicians and had spent all that she had and was nothing bettered, but rather grew worse. So she became worse. She didn't get any better according to this story. But Jesus was there. So us, Jesus is there. We can come to him. When she heard of Jesus, she came. So, she's not supposed to come near people, right? She's unclean. But she pressed forward amid the crowd. She pressed, the word press, behind. She came close to Jesus. She came. I'm going to get well if I can just, she says. But, for she had said, she came behind Jesus and pressed and got into the crowd. I don't care what they're going to say. I'm going to go to Jesus. Oh, it's like for me, I don't care what people say. I'm going to go to Jesus. I'm unclean. I'm a sinner. I have problems. I'm going to press forward. And this woman said, I will press through the crowd to Jesus because he's the only one. She said, if I may but touch his clothes, if I may just touch his clothes, I shall be whole. In the other stories in the Gospels, in Luke or in Matthew, it's talking about if I may just touch the hem of his garment. And the hem of the garment of the Hebrews before had a blue ribbon, okay? And this blue ribbon or tassel in the edge of the garment of the Hebrews was representing the law. Not only the moral law, but even the ceremonial laws. And the ceremonial laws were given for them so that the Jews would be the healthiest people on earth because they were the ones supposed to spread the gospel of God to the heathen around them. So in her Hebrew mind, she probably was thinking, if I but touch that symbol of the law, the symbol of what is going to help me get better, what's going to heal me, that miracle that God has provided, if I can just but touch the hem of his garment, she will be healed. She said, I'm going to be healed. So when she did that, boom, okay, she felt herself getting well. She felt like this thing disappeared. Sometimes in the natural remedies that we do, we get well very quickly. But sometimes it takes time. And yet you will feel that your body is getting better. Imagine if you've been bleeding for some time, you got to build your iron content. And iron is not easy to build up. Iron content, you have to take food or maybe even supplements to enhance your iron content. And the bone marrow will take this up and make it. You have to eat properly, get proper protein, have the iron, and all the rest of the stuff that you have to do. Sleep early, exercise, to enhance the production of these hemoglobin so that you can be better. This takes time for you to recover. If Jesus were here, you could just touch the hem of his garment, you'd get well. But we are asking for a miracle, and God is pointing you to take care of your weight, take care of your food, take care of your exercise, take care of your sleep, take care of your stresses in life. I will take care of you if you do so. That's because he promised, right? So we can come to him and say, Lord, it's not easy for me to check what kind of food I want to eat. I need to eat this. But if I don't like vegetarian, oh, you got to think about what you're going to do, sister. You got to think how you're supposed to fix your mind to do the best you can do so that you're better. Because how can you serve the Lord? How can you be the best you can in this world, in the service of God, if you're sick? I really have a personal, because I used to be sickly, and I strive to be healthier. And the natural remedies, they do help me. So I'm touching the hem of the garment of the Lord every day. I pray, my dear sister. I pray, my dear sister's family, your young lady, young family girls, and coming up, even your grandchildren, girl grandchildren. And it is like this. The ovaries of your grandchild depends on you, lady. A pregnant woman affects the grandchildren's ovaries and ovulation. Just like in the first and the second and the third generation are affected by what I do when I'm pregnant. So it is very fascinating that when I'm not healthy, my baby that's growing within me, her eggs, the eggs of the baby within me is already affected by what I do to myself. So my granddaughter's fertility depends on me. It is amazing. So when we're pregnant, we want to be, the best pregnancy. You take care of your body. If you do the right thing, your baby will come out right. That's sort of a blessing. But if you don't, your baby will come out problematic too. That's like epigenetics down the line. So God is telling us now, we're made aware. Bleeding is not, menstruation, that's run-of-the-mill things. It's normal in life. No, sister, we got to take care of our bodies. Our HPO axis have to be cared for like our lives depend on it. And our service to God depends on it. So we're going to continue with our series in the coming days. And we we ask the Lord to help us. So should you bow your heads with me as we ask the Lord for blessings in our lives. Gracious, kind, loving Heavenly Father, our Master, our great provider, the physician par excellence, our Creator. You know the ABCs of our lives. You know every little cell in our body. You know my endometrium, Father. You know my uterus, my ovaries, my fallopian tubes. You know my ovaries. You know my pituitary, and you know my hypothalamus, Father. I humbly ask that you bless all the women within the hearing of my voice, Father. We want to be the best that we can be for you. Many times we fall short, but we know that if we come to you, you have the best for us. You say, I wish above all things that thou mayest prosper and be in health, even as your soul prospers. You want us to be healthy, Father, and we want to be healthy as well. You're coming soon, and we want to be ready. We want to be the strongest we can be, so that we can finish the work in this world. So your coming will be hastened. We surrender our thoughts to you, Father, for your control. We surrender our will to you for your control, so we can be the kinds of women that will bring a big smile to your face as we serve you the way you want us to serve you. Thank you so much, Father, for being kind and merciful. Thank you for forgiving us of our sins. Thank you for keeping our names in the book of life. For Jesus' sake, amen.